So I think we're seeing a lot of dedication, a lot of dedicated efforts toward the sophisticated quality collection of tissue specimens. I think we are still rather far away from the holy grail of having a test that we can run, prospectively when we meet a patient to tell us what type of therapy that patient should have. But certainly, the importance of having those assessments is noted by the immunotherapy community. The problem, as I've written, is that the immune microenvironment is very dynamic, and having one assessment that captures everything that's relevant is rather challenging and may be out of reach, but certainly it's a topic of hot research, and the value of it is very much recognized. I think that we're working on it, but I think that we're still a bit of ways from having hard tests that we can sort of order in clinical practice. I think it's very important, and I think it's important to understand the relevance. I just came back from Society of Melanoma Research in Manchester, England, and both Drs. Jennifer Wargo and Jennifer McQuaid gave excellent talks in this area. I think what we're recognizing is that there's sort of I sort of think of the immune system in three parts, even though they're not separate, but they're integrated. I think of the tumor itself and its genomic factors and genomic presence. I think of the tumor microenvironment that tumor sits in and interacts with. And then there's host-specific factors, and that's where the microbiome comes into play. But certainly, understanding the relevance of, how an individual's, individual microbiome may be, applicable to the response to immunotherapy and the development of the cancer is mind-boggling, but it's, I think, going to be a very, very important topic, and we're going to hear a lot about it as we move forward.